Hello viewers. Now we can learn about the liver anatomy. First part. First we can start from the location. Where it is located. Right, left and hypochondrium. Right and left hypochondrium and epigastrium. It weighs about 1.5 kg. It has 5 surfaces. Right surface, superior, inferior and anterior and posterior. Borders. It has one prominent border, that is inferior. Inferior border also has two notches, interlobar and one cystic notch. Now we can see the anatomical division. It is divided into right and left lobes. The right lobe constitutes about 5 by 6 of the left, that it amounts high right. And how we divide it anatomically? Anteriorly and superiorly by falciform ligament, and inferiorly by ligamentum teres hepaticus, and posteriorly by ligamentum teres venosum. Now we can see some parts of the liver. First one, cardiac lobe, that is located in the right lobe in the posterior surface. See here, this will be the cardiac lobe. Now we can see the boundaries. It is so important. By right side it is bounded by IVC groove, and left side by ligamentum venosum, and below and began by the porta hepatis, which is a structure by which the hepatic artery portal vein will enter and leave the liver, and by above it is continuous with the superior surface. That's all. And also our cardiac lobe has two processes. What are they? Caudate process and papillary process. Next, quadrate lobe. It is located in the inferior surface. Now the boundaries. Right side by gallbladder, and left by ligamentum teres, and front by inferior border, and back by porta hepatis. See here. This is our quadrate lobe, right? Next, porta hepatis. I said no. Which is a structure which denote the structure which is leaving and entering the liver, right? It is located in the inferior surface. It also has some clinical importance. Next, left lobe. It has one region called tuberomental or omental tuberosity. As it will be having it will be looking like a round elevated region in the inferior surface of the liver. Next, bare area, very important. Boundaries also needed. And see, it is bounded by superior and inferior coronary layer of the coronary ligament, and by right side right triangular ligament. This is the bare area. Why it is called bare area means which is not covered by peritoneum, and it's like it related directly to the diaphragm and the right suprarenal adrenal gland. Okay. One important point about the cardiac lobe, which is direct contact to the lesser cardiac lobe. Okay, then cardiac lobe. Okay, now we can see the relations of the cardiac lobe. At the empty stomach, it will be related to first part of the duodenum and transverse colon. On full or distended stomach, it will be related to pylorus or first part of duodenum. Okay. Now the relations of the right surface. See here, it is related to 7, 8, 9, 10, 11. 5 ribs also. See, we can divide it into 3 1/3 parts. First 1/3 will be related to let's keep like while taking liver biopsy, when we insert a needle, we insert between 7th to 8th ribs. It will first pass via diaphragm, then pleura, then reaches our liver. Next, 1/3 region, if we insert, first it passes the diaphragm, costodiaphragmatic recess, then it reaches the liver. Suppose below 1/3, it is penetrates the diaphragm, then reaches the liver, right? So it will be useful marking for surgeries and techniques. Now we can go to the blood supply of hepatic structure, liver. See here, two supplies, hepatic artery and portal vein. Hepatic artery just 20% to organ. It is an end artery. We have to keep remember. Okay. Remaining 80% are supplied by our portal vein. See here, First portal vein will enter. It reaches the hepatic sinusoid, right? Next, hepatic artery is there. It will branch into right, left, both right and left. Then again, it will give to segmental branches. Then it will give to interlobular, which also reaches the hepatic sinusoid. After this, the blood flow will pass via interlobular vein. Don't forget lobular vein. Then it passes via the sublobular vein. Then again it goes as hepatic vein, and it gives two tributaries, right? For artery only we will say as branches, upper, lower. Upper as right, middle, left parts. Then it will drain to our great IVC. Next, nerve supply. Hepatic plexus, which contains both sympathetic and parasympathetic. Next, we can see about the lymphatic drainage. See here, lymphatics will be beneath the peritoneum, as the liver is covered by peritoneum, right? First, superficial from the caval, IVC, lymph nodes, then paracardial near to the cardiac, then hepatic, then celiac, then along coronary ligament. It reaches the thoracic duct. Then superficial is drained by like that. Then deep includes both IVC and hepatic. Okay, easy only. Hepatic segment, like anatomical division, we also has physiological division. The line which separates the lobe as physiological division will pass via cystic notch, then gallbladder fossa, then caudate lobe midline, okay, and the posterior surface, then IVC groove. See here, how we are dividing as totally 1, 2, 3, 4, 5, totally 8 segments are there. Okay, you see, you draw an arrow like this, okay. First segment, 2, 3, 4, 5, 6, 7, 8. It is very important, we have to learn. Okay, so 8 segments are there. Okay, now the development, right? At that month of the neonatal period, it will be about 1/3 of the total body weight, and at 7 month it will be about 1/5. Why it amounts this much of the body weight weighs? As it will undergo the organ for hematopoiesis, right, in the younger ages. Now its development. See here, from the ventral part of the foregut, it gives a hepatic bud, which will be giving us two twigs, right? Pars hepatica and pars cystica. Pars cystica will be going converted as gallbladder and cystic duct in future. See here, portal lobule. At development, we will call it as portal lobule, and at a final stage, it will be said as hepatic lobule. Now its branches, it will again it branches and it forms the full structure. Liver structure. See here, at septum transversum, a structure called hepatic trabeculae, which forms the hepatic duct for biliary passage. Then it also forms the space between the, that is interstitial tissue, space between the hepatic sinusoids. Okay, it also forms the liver cells which lines the hepatic intrahepatic biliary system. Lining cells, okay. See here, the hepatic sinusoids at the embryonic stage, it will communicate both vitelline and umbilical vein. Okay, communicate with the umbilical and vitelline vein. See here, now another thing, septum transversum. No, it will give rise to Kupffer cells, hematopoietic cell, and connective tissues, and Glissen's capsule, the capsule which covers the liver. It also gives rise to triangular and coronary ligament. But the falciform and the left omentum comes from the ventral mesogastrium. Okay. Now we can go to the applied anatomy. Yes, yeah, our video is going to first one, radial slope. What is it? A tongue-like extension of right lobe. Next, Bringel's maneuver. What is it? In case of some surgeries, liver surgeries, if we have to stop the overbleeding, we can compress the hepatic artery or portal vein at the free edge of lesser omentum. This maneuver is called Pringel's maneuver. Okay. Next, liver biopsy. You have to pass your ninth intercostal space. That is middle. Okay. Ninth IC space. Then liver resection. See here, some organisms can regenerate if, even after it's destroyed or its removal. But we cannot. It cannot regenerate after complete removal. But it can regenerate till 80% of its removal. Okay, within 6 to 12 months, it will reach the normal size also. Liver grow more in fetal life. Why? See here. Due to left umbilical. Why it is more in fetal life? See here. Due to left umbilical vein and ductus venosus. See here. Umbilical vein carries oxygenated blood from the mother, right? See here. It is due to rich O2 supply. The region which has more oxygen supply, it grows a lot. Then why right lobe is enlarged more than the left? Why? See here. Portal vein is there, right? That is right and left branch. What is the right comes from where? Superior mesenteric, which will drain the right lobe. Superior mesenteric comes from the intestine, right? GIT, which has more nutrition from our food. And see here, left branch of portal vein comes from left lobe. Sir, no, left lobe. It will drain the left lobe, right? Which comes from the inferior mesenteric and splenic vein, which which is more narrow and it has less nutrition. That's why it is. We think some people guess that that's why it is less in size compared to right lobe. Okay. Thank you, guys.